எல்லாம் தெரியும்.
ஆரம்பிக்க போகுது.
Dear friends, we are tracking a main subject today, the Puberphonia Eradication Program, and this is the second day of the event on this program. So it is a live chat, and happy to meet my friends. And we know it very well. Today is 21st May 2022. Today is Saturday. So to memorize what we have already told you previously, we want to give you a short list of what is happening. The first point is puberphonia is not a disease at all. It is a mutation of the voice. Voice is false, that's all. No disease for them. All the structure in the body, hormone, everything is normal. So it is not going to injure them in any way. That is why these boys are little upset. So they have brought out in olden days and until recently now also, it is a functional voice disorder occurring at puberty, in male only. Because they have upset in some time, they put as psychogenic. Psychogenic is not the original problem which created puberphonia. Because of puberphonia at the puberty, and the voice is not suitable for a adult male of 15 years, they get upset. So, without any anatomical abnormalities in the pharynx or larynx, they get some psychological problem, emotional problem. Inappropriate to use the voice mechanism, because the habitual use of high-pitched voice, speaking voice, may be associated with muscle tension surrounding the neck, and they feel as if it is their problem given by the Almighty, the God. Say they don't know where to go, so they try to live with that. These two boys are my students. They are not patients. They are my students. They want to learn about the technique of speaking and how to get rid of this puberphonia voice. நீங்க எங்க இருந்து வந்திருக்கீங்க தம்பி?
கடலூர் மாவட்டம் பண்டூர்ல இருந்து வந்திருக்கேன் சார்.
சொல்லுங்க உங்களை பற்றி தம்பி. என்னைக்கு வந்தீங்க?
வந்து 3 நாள் ஆச்சு சார்.
இன்னைக்கு குரல் எப்படி இருக்குது?
முன்ன விட இப்ப பெட்டரா இருக்கு சார்.
பெட்டரா இருக்கு. உங்க குரலை கேட்கறதுக்கே எனக்கு சந்தோஷமா இருக்குது. சோ இதனால நீங்க முதல்ல என்ன கஷ்டப்பட்டீங்க, இப்ப என்ன ஃபீல் பண்றீங்க சொல்லுங்க. தெரியுதான்னு பாருங்க. ஏன் போனே ஓகே சொல்லுங்க தம்பி.
எல்லாருக்கும் வணக்கம். என் பேர் சத்யராஜ். கடலூர் மாவட்டம் பண்டூர்ல இருந்து வந்திருக்கேன். இதுக்கு முன்னாடி என் வாய்ஸ் ரொம்ப கீச்சின்னு இருக்கும். எல்லாருமே கிண்டல் பண்ணுவாங்க. இப்போ சாரை யூடியூப்ல பார்த்தேன் வந்து 4 நாள் ஆச்சு. இப்போ 4 நாளைக்கு என் வாய்ஸ் ரொம்ப பெட்டரா இருக்கு. இது எல்லாமே சார் தான் காரணம். இன்னும் யாராவது இருந்தா பார்த்துட்டு வாங்க. சார் எல்லாருக்கும் சரி பண்ணுவாரு.
ஆமா, இது ரொம்ப நல்லா இருக்கும். அத இது பண்றதை விட நமக்கு ஒரு அப்செட் இல்லாத வாழ்க்கை வாழணும், அவ்வளவுதான். உங்களை பற்றி சொல்லுங்க தம்பி.
நான் கடலூர் மாவட்டம் சிதம்பரத்தில் கிட்ட என்னுடைய லால்பட்டிலேருந்து வரேன். எனக்கு வந்து Puberphonia ஒரு ரொம்ப நாளாக இருந்துச்சு. ஒரு சாரோடைய யூடியூப்ல சேனலில் பார்த்தோன்னா நான் வந்து சாரை பார்த்தேன், கால் பண்ணி பேசினேன். இதுமாரி சரி வாங்க வாங்க அப்படின்னு சொன்னாங்க. வந்து இங்கே ஒரு 4 நாளாக ஸ்டே பண்ணி வாய்ஸ் கொஞ்சம் இப்போ நார்மலாக இருக்குது. இன்னொரு ஒரு நாளில் என்னோடய வாய்ஸ் க்ளீன் ஆகிடும்னு நான் நம்பிக்கிறேன்.
ரொம்ப நன்றி தம்பி. இதுல என்ன ப்ராப்ளம் என்னன்னா, the voice should not get upset. That is the only thing I want to repeatedly telling them. It is not a disease at all. It is a false voice. And all over the world, everybody knows it can be treated without any surgical intervention. But nowadays, surgical intervention had also good only. But the main treatment is only speech. There is no question of any other. Voice therapy is the treatment. The voice therapy may be a direct voice therapy or indirect voice therapy or a audio-visual feedback. But little research we have done, and we have found out the culprit is not the vocal cord, because vocal cords are normal. When it is normal, I thought there is no reason for us to think of treating the vocal cord. இப்போ வோக்கல் கார்டுனா உங்களுக்கு எல்லாருக்கும் தெரியும், வாய்ஸ் பாக்ஸ் இருக்கு. அதை முதல்ல டெஸ்ட் பண்ணி பார்த்தோம், அது நார்மலா இருக்கு.
ஓகே சார்.
So it's not a problem with the vocal cord at all. அதனாலதான் நாங்க என்ன நினைச்சோம்னா, there is no hope or no point in treating the vocal cord. But all over the world there is a suggestion that only Adam's apple, உங்களுக்கு தெரியும் நினைக்கிறேன், கழுத்துல மேல பாருங்க, கழுத்துல இப்படி நிக்குது இல்லையா? Really, the only thing is vocal cord. All these points now I want to tell in Vanga, Santi Vanga, other language also. Slowly, I am learning all Indian language also. தெலுங்குல முன்னாலே எப்படி வந்தாங்க, நம்ம என்ன பண்ணோம், எப்படி ரிலீஃப் ஆறாங்க, తెలుగులో சொல்லுங்க.
ఫస్ట్ లో వాయిస్ వచ్చి కీచుకోరల మాదిరిగా ఉంటుంది. చిన్న పిల్లకాయల మాట్లాడే వాయిస్ వస్తుంది. మళ్ళా కొంచెం ఆడవాళ్ళు మాట్లాడే వాయిస్ ఉంటుంది. వాళ్ళకంతా బాగా మగవాళ్ళ వాయిస్ మారే మాదిరిగా చేస్తున్నాం. అయితే ఇక్కడ వచ్చిన పేషెంట్ అంతా బాగా మారైపోయిండారు. అయితే వాయిస్ వచ్చి మగవాళ్ళ వాయిస్ మాదిరిగా బాగా గట్టిగా మాట్లాడే మాదిరిగా వస్తా ఉంది. మీరు ఎవరికైనా తెలిసిందంటే పంపియండి. కీచుకోరల మాదిరిగా ఉండే మరి అదే చిన్న పిల్లకాయలు లేదా ఆడవాళ్ళ మాదిరిగా మాట్లాడే వాళ్ళు వీళ్ళంతా ఉంటే ఇక్కడికి పంపించారంటే మీకు వాయిస్ బాగా వస్తుంది.
Slowly we will include other regional language also, because we are getting patient all over India, and we can say all over the world also. I never want to exaggerate. Yes, people are coming from foreign place also, but still my feeling is I am learning Hindi, but it is little difficult for me, but I should. And I have written a Puberphonia book in English and Tamil. I want to translate these books in all languages also. When I am visiting America, I think we have to talk in their another language also. Everybody knows in America, they are not only talking in English. So we had the opportunity. Okay. So now my point I am interested is our treatment is not on the larynx or vocal cord. Our treatment is the organ which is not working. Vocal cords are good working happily. There's no problem. So what organs are not working? This we have found out from our experience. They had come with nasal voice. That means the resonating mechanism is not proper. So what is that behind? We thought the is a culprit organ. I know it very well. Lot of work has been done in the vocal cord structure because they have found out there are many reasons in adults the vocal cord is different from children in male. So that had prompted us ENT surgeon, why not we work on the vocal cord to correct it by doing a relaxation thyroplasty, by a medial approach, by usually we do traditionally relaxation thyroplasty and lowering the pitch and creating an incision bilaterally in the thyroid lamina and depressing the anterior segment of the thyroid cartilage. And this was why we are doing this surgery. In recent years, less invasive intervention is a window relaxation thyroplasty. This is involving creating a window at the anterior comes here and which is then displaced posteriorly. Now we have seen 870 cases of puberphonia and treated it. All these cases, directly or indirectly, we are recording because so far we have published 7 articles in the national and international literature. We want to publish more also because by Almighty God, our Muruga, our player God, we got rich experience in these cases by seeing the 870 cases. Number one, the culprit is not vocal cord, it is uvula. And the air force which is created. There we have found out what are the mechanisms involved in creating puberphonia. These are all little new. And moreover, we have to find out the strength of airflow in the posterior to the uvula, anterior to the uvula, and in the mouth in the nose, in the sinus, and everything we have to calculate. Now, for that only we are doing multiple studies of the uvula by ultrasound, CT scan, and MRI. It is not difficult at all. Even for sleeping, we used to do the same study. How snoring occur? What is the mechanism of uvula? And according to that, also we can do uvulopalatopharyngoplasty surgery in snoring. So the same thing we are putting forward and trying to do the further study for doing the research. So little going once again to the basic thing. It is already reported the incidence of puberphonia is estimated 1 in 9 lakhs. It is a little old calculation. Now we feel it is much more. In an adult population, 1% of the population is having voice change. 1%. Every 100%, 1% is having a voice change. One among them is puberphonia. So now I am more interested in making the census. Today, my point is puberphonia is a common problem occurring in male in puberty time. So we are finding puberphonia by their voice itself. Puberphonic voice is 10 types. We have made our own classification. There are 10 types of puberphonic voice. It will take some time the people to understand whether 10 type of voice is there in puberphonia. Simply our great people have told that it may be husky, low voice, and but we are from our 870 cases, we are able to categorically say there are 10 type of voice. So this is what we are aiming at Puberphonia Eradication Program. From the voice itself, you can find out whether a male is having puberphonic voice or not. But it is easy to find out a female type of voice. But it is not always the same. As I have told you, there are 10 types. In phone call, most of them feel the opponent, the receiving party feels as if a lady is talking. So when they converse directly, this need not be a female voice because directly we are seeing a male and seeing the male talking to us. We don't feel that voice change much. This is what happening to the friends and parents. So most of the cases, the parents won't accept that the boy is having female type of voice because they are constantly listening the boy's voice in high pitch. They feel it is normal and he is okay. This is a problem in diagnosis and treatment also. because the relative hesitate to accept the boy is having puberphonic voice. Relatives are hesitating to tell phonic voice, female type of voice. But when he interacts in phone, he simply says, I am upset, because the recipient of this phone call says, thank you, madam. So I am getting upset. Not only like that, when they return back, that next day they demand for the same phone call lady to respond to them in business affairs. Where is that lady? It is not available. A male only talk with them. So one is very common female voice. Second is childish voice. The child voice persists in many females also. We used to tell Malalai Kural. This is very common in female, and male also it is there. Malalai voice. It is a very, very bad for them to come to a great level, a powerful level in male. So that is second type. Third thing is musical voice. Everybody love music. That music also, if it is coming from a lady, will be happy. So the male boys also try to sing in some of their tones as girl and to attract the audience. That is the problem. Many of the good singers, when they change the pitch, it will be just sound like female, which may be attractive, but the manly power is lost. Here I use the manly power. It is different. Whether the lady's voice is powerful or gent's voice is powerful, whether high pitch is powerful or low pitch is powerful, it is phylogenetically it is told high pitch is powerful. Ladies' voice are powerful. Ladies' voice can be heard to a long distance. When they are in agony, they shout and it should be heard to the other long distance places. But in male, it is not like that. Male, it is entirely different. Their strength is body strength, not voice strength. That is the difference between low pitch and high pitch. But the question is, in our place, when we talk about this pitch and power of the voice, when you bring a voice from the abdomen, it is heard to a long distance. We can categorically say, when somebody calls a person, they try to bring out a word from the abdomen. This is a custom in our village or our place. When you call, I'm just calling Ramu. If he is in a long distance, I won't say, Ramu, come here, Ramu, come here. No, no, no. Hele, Ramu. That means the strength should come from abdomen. Are you able to understand me? Hele. So that means directly the sound is coming from abdomen to make the strength. So our starting point of the treatment is also the voice should come from abdomen. So this is the small story of how you use abdomen for strengthening the voice. So this is practically we are doing it. So, but voice is essential and should be high pitch for female. When they are in agony, they have to call for a distance. But in male, by shouting, it is not going to solve the problem. By fighting only, it is solves the problem. So that is the difference. So now I have told about three type of voices. One is female voice, child voice, and musical voice. The musical voice, there are other 7 types, I will tell later. The musical voice which created more problems in puberphonic boys when we take the history of these boys. A boy used to sing like a female in some functions, some troops. So everybody appreciating him because he is singing like a girl. But when he become adult, this voice itself become a for him. The people are demanding that he should sing in a female voice. Even Michael Jackson, his voice is a little puberphonic. The crowd is attracted by his puberphonic tone. So what they have done, repeatedly when he had become adult also, they want to have the puberphonia voice. So adult male, if I want to go on maintain the same amount of female type of voice, what I have to take? I have to take hormone injection to maintain the female type of voice. What will happen to me if I take hormone tablet or injection regularly to protect my lady's voice even when I become adult male? Then my whole system will be collapsed. It may be in the form of steroids, other tablets are there, injections are available. So this will give a small happy when you sing only, but your body won't accept that. You will have different changes in hormone. Every organ you will have a change that will make you little different in your life also. So only 3 points I have told, remaining 7 points I will do it in the next class, because a class more than half an hour is not much. I hope we had, how many people had come, Ma? Any idea? எத்தனை பேர் வந்திருக்காங்க கண்டுபிடிக்க முடியுமா? There are more than 30 people had come. I'm so happy, and we'll continue in different language also. I pray I may learn different language of Indian language and foreign language very soon, because I want to translate my book in different languages also. So I want to talk in different language also. Today our assistant had talked in Telugu. I pray that he should read Malayalam, Kannada, Hindi, Sanskrit even. Okay. So Thank you very much. Great. We'll meet next Saturday. We'll meet. So next Saturday is 28th May. Meet at 5 o'clock. Thank you. Great.